2015 survey of U.S. healthcare consumers, 52% of respondents reported searching online for health or care-related information. So I'm really excited to welcome Kian Sinai, who's the CEO of Independa. We're here to really talk about the consumerization of healthcare, and he is a guy. He's been doing it for a long time and has incredible insight. So let's welcome him to the stage.
Thanks. That's your voice. Okay, thanks. Hi there. Can everyone hear me in the back? Make sure I have the clicker. Okay, great. So it's great to be with you today. Jill makes it sound, I think in dog years, it's about 50 years in the industry. So a long time is 7 years. So let's talk about the consumerization of healthcare. And when Jill and I talked about this topic, there's a component of a platform that I think gets used, gets thrown around as a term that I want to share with you. I think is really important to think about that as how we address how consumers can actually be healthy inside their own home, whether it's in their home or in a senior living community. So this is my favorite slide of all the slides that we have. It really shows you an inverse of a typical slide where you pay less and you actually get more over time. So the less you pay, the happier you are, higher quality of life, and where is that happens? It happens in your home. And the more you go to the left, typically you have an order of magnitude more cost, anguish, complexity. So that's a given. We all agree with that. What used to be about independence for the elderly, though, because of the Affordable Care Act and because of readmission penalties, because of Medicare Advantage plans, value-based payment, bundled payments, what else am I missing? PACE programs. So all of these are really different ways, population health management. There's different ways to say the healthcare system is actually aligning itself with that graph. And that is what we all want, which is not to go left, right? So keep that in the back of the mind. And the healthcare in that model is being aligned with the consumer. In the past, the consumer wasn't aligned with the healthcare system, which is why the doctor would actually make money on the transaction, let's say, or the episode. But more and more, we're seeing alignment. So if you look at some numbers here, the important takeaway of that slide is the area in the blue. So there's numbers that we all know. So $3 trillion roughly of healthcare costs, about $1 trillion of it being waste. And we talk about it like it's going to be waste that goes away. It's tough to get rid of that waste because it's other people's profits. And, I don't know if I can go back. And on the left, we know what's happening. We're going from the episode to continuity of care. We're going from volume to value. We're going from patient to person. Very importantly, we're going from the location of the provider to really the person's home. Again, it's all about the consumer. And the blue is the consumer. So that's the takeaway, is the costs are really on the consumer side. Where people live is in their homes, and the cost of the consumer on the system. So another way to look at this, I'm going to come back to this chart afterwards, just in the interest of staying with time. So in our view, the platform is the winner that ties all of it together for the consumer, because you need to approach people based on different conditions that they have over time. And we know in this environment, we know about IoT, we know about health devices, we know about security, we know about safety, and each one of those really is sort of a piece of the elephant, and you touch it and somebody ends up with the tail and says, oh, that's telemedicine. And there's a whole market around that, and people compete in it. And then somebody else touches the trunk, and that's maybe health device or maybe IoT. The idea is that if I was taking care of my mom, I don't want to know about any of that. I want to know if she's maybe in the bathroom for 4 hours. I'd like to be notified, but also maybe if she hasn't stepped on the scale, I'd like to be notified. And maybe she should get reminded first, too. So there's two challenges. One is, how do I engage an 80 or 90-year-old? And when we talk about the consumerization of healthcare, in our world, that's really a big part of it, because when you think about where the cost is in healthcare, I showed you in the other graph, but another way to look at it, 76% of costs are chronic conditions. A big portion of that is elder care. Obviously, a big issue in elder care is isolation. which we have allowed to run rampant because there was no insurance code for that, for instance. So the symptom of isolation is things like self-neglect or medication neglect and recidivism into the system. So how do you address isolation? Guess what people are doing when they're isolated in their homes? Audience participation. What are they doing? Nothing? No, they're doing something. Thank you. That's why, oh, there's a TV in that slide. There we go. This is just going on its own. So the TV for us in our world is actually a holy grail of how do you engage with someone from a distance without a laptop, without a computer, without passwords and virus scans and tablets, let's say, and power supply issues and so forth. So that is a big deal for us, and we feel that's a key advantage for the marketplace as a consumer. But also all the other devices have to tie into it so you can have central management, central reporting, and so forth. So the consumerization, by definition, the middle thing over there is a platform. So you have to be able to tie all sorts of things together. You have to have commonality and thresholds and reporting and alerts and so forth. And another way to look at it is, I'll touch on this here and come back to the slide as the final slide, but every one of these areas is of concern to someone who wants to stay independent or someone who wants to be healthy. So there's a medical component, there's a physical component, so you may want to wear a Garmin or a Fitbit or an Apple Watch, et cetera, activity tracking. There's an environmental component, whether it's a Nest or whether it's how cold it is outside. So you want to tie everything together so that you can catch little things before they become big problems. So the next few slides are much more sort of symbolic, but when you think about the consumerization of healthcare, what are the types of companies that are really the owners of the consumer experience? Outside of the medical side. I'm not talking about the medicalization of the consumer, right? That's very different. I'm talking about the consumerization of healthcare. So the medicalization of consumer is, let's say, telemedicine. It's a great thing, creates efficiencies, creates quality of life for people who don't have to maybe travel in. There's payments that's going to happen more and more for that. That's awesome. But telemedicine is itself an episode. What do we use now to actually keep someone away all the time so they manage themselves, their friends and family manage them better? So on the consumer side, think about companies like telcos or power grid companies or satellite companies, or even on the retail side, maybe that's a Best Buy or a Staples. So when you see, or Walmart coming in from the retail outlet side, there's a lot there around who has the consumer experience and ownership and interaction, and really going from that side into the home, I think is a key to getting this done differently. Now, the medicalization of the consumer is also going on, which is also good for the system. Some savings there, things like a hospital discharge or home health coming into your home. And the overlap of all that is in the middle, where technology really allows all this to happen. We don't have enough beds, we don't have enough doctors, gerontologists, we don't have enough taxes, and people employed to actually take care of our greatest generation, and even the generation after that. And this is not just for the US, this is something global, and technology has to play a role in that. So with that backdrop, this is to me what the Booby Prize looks like, which is really taking our medical challenges that we've had in our sick care system and having expensive inundation of the consumer that way. So that is not where we want to be, and we're not an FDA Class 2 device, although we're HIPAA compliant and FDA Class 1 device. So we don't help with diagnoses, that's really important, but we think the consumer should have an overall sort of care management in their life and be able to catch little things before they become big problems. And then the professionals step in with FDA Class 2 devices. So another way to visually look at that is sort of the Booby Prize is the sick care system still dominates with cost and complexity and episodes, except it's a little bit more savings because they happen more and more in the home, and that's fine. Technology is used, but it's really all about, you've heard maybe here today and overall, it's all about payment, follow the money, who's got the money. That's really the sort of the situation that we're in, at least in the US, on the sick care side. And the consumer is an afterthought of that system. Where we think the bullseye is where it starts really with the consumer first. Technology helps the consumer in engagement and compliance, and at the end of the day, everyone benefits as a sort of the result. The sick care system, the healthcare system sees you less, and that's really the consumerization of healthcare versus the medicalization of the consumer. In our world, we have a tiny little candy bar-sized device that attaches to any TV. We call it the independent any TV companion. as well as LG is an investor, so they've embedded our solution inside all LG commercial TVs worldwide. So if you're in a hospital bed or in a short-term rehab or nursing home, any of those, you buy the LG TV Independent. Helps both you, your family, as well as the operations of the business, delivering things like menus and surveys and other things to help things make things more efficient. But then if you're in the home, home care, and et cetera, kick in with our platform. Very simple. Here's my second prop for the day. Really simple, remote. Simplicity is key in all of this. If you want to go into the consumer, you have to just make it really super simple. And this is where I mentioned about the previous slide. So we know about this slide as well, where all the costs are up top. And really, if you can have a different view of the costs into the system, if you can just avoid the rising risk getting into the system, if you can delay, another way to look at it is if you can delay someone's move into the next episode or stage of care by 1 month, there's consumer solutions that could actually be paid for the lifetime of that solution. So that's pretty compelling ROI from a consumer standpoint versus a medical standpoint. And another way to look at it is, the platform is the winning area because around the person, so these are all individual siloed industries, they're great, lots of individual companies in them, but then as a person coming back to that to close, the platform of platforms really is the one that connects everything around the person. So it's not patient-centric, it's not a portal to an Epic data element, it's really person-centric, all the considerations that you have to keep someone healthy and independent and away from the system. So that's my 10 minutes, I think. That's the last slide.
Thank you.
Thank you.